Welcome to the Think for Yourself Clubhouse. I am Bill Martin and my co-host is Aggie Martin today. Our guest is Sasha Johnson, who is the director of the Jackson County Harm Reduction Program. We're going to talk today about drug overdoses, Narcan, needle exchanges, and the like. I know we spent a lot of time on this podcast doing editorials and talking about politics, but this is rather serious public policy issue in our local county, Jackson County. Sasha Johnson works for the Jackson County Health Department. Who's your supervisor?
Kevin Aston, the county's health commissioner.
Okay. And you've got a college background?
I do, yes. I have a bachelor's degree in health services administration.
That's from?
From OUC, Ohio University, Chillicothe.
Okay. Another Bobcat?
Yes.
Aggie's a Bobcat. And do you have any licensures from the state of Ohio?
I do. I have a certification as a community health worker through the Ohio State Board of Nursing.
Okay. And when did you start out with the Jackson County Health Department?
Most recently, 2022, I started back there. I did my internship out of college there previously in 2017. And
what we're talking about is a health program established and maintained by the Jackson County Health Department.
Correct.
Sasha, first off, what is the Jackson County Harm Reduction Program?
The Harm Reduction Program at the Jackson County Health Department is a program that we operate to reduce drug-related injuries. Mostly that is our safe syringe program and the distribution of naloxone and other harm reduction supplies.
So your philosophy, as I understand it, is that you don't go around saying drug addiction is a bad thing and you have to get right, with God or whatever. What you say is there's harm out there and let's reduce the harm.
Yes. We meet people where they are, really. If they're using drugs currently and have no desire to quit, we try to meet them there and say, well, what can we do for now? What can we do to reduce the risk of your behavior?
Is that what you would call the mission of your program, reducing the risk of the behaviors out there that you see?
Yeah, I think so. I did write our official mission statement, if you want it.
Sure, let's have the official mission statement.
Our mission is to meet people where they are, prevent overdose and the spread of infectious disease, and support pathways to recovery while strengthening the overall health and safety of Jackson County.
Okay, good.
So, yep.
That's thoughtful.
Yes.
When did it begin?
The syringe service program began in 2022, right before we moved to our new location. So we started it right here downtown.
Okay. And what used to be the Allison building, I think, Aggie?
Yes, the Allison building.
BJ Allison.
And then you moved across the app to new premises.
Yep, right across from Holzer now.
And that was a Thursday evening program, once a week?
Yes, Thursday evenings at that location, 102 Twin Oaks Drive. We do it 4:30 to 7. And then we also recently opened another location in Wellston at the Community Action. That operates on Wednesday afternoons from 1:30 to 3:30.
How many employees are working in the program?
Currently myself and I have two other community health workers. One who is also certified through the state and one who will be completing training here soon.
And you're the supervisor?
Correct.
I'd like to get the statistics. Now, viewers will be having some what they call the B-roll overlays, and one of them will be the statistics for Jackson County overdoses and overdose deaths. And there is a schedule from 2018 through 2025. And let's just go with the overdose deaths for a little bit. I notice here there's a peak in 2021, and you counted 45 overdose deaths.
45 overdose deaths, yeah, for 2021.
And for 2025, and that I take that to be the complete year.
That is a complete year.
And how many did you count then?
We had 10.
Okay. Now, in our preparation, we compared that to the numbers that the state of Ohio had prepared.
Correct.
And they're different.
They are.
The state of Ohio has, I believe, lower numbers in both cases, and you explained why, but would you explain to our viewers
Yes.
the apparent discrepancy in the numbers?
I did explain to you my understanding of it, and I also did some research between our prep and now. To start, there are several different ways that the numbers are collected. The state is bound by using the primary cause of death when they count overdose deaths.
And what we're talking about is on the death certificate, they look at that square that says primary cause of death.
Correct.
And if that square says the drug overdose, then that's a ding, and that goes in the column.
Correct.
If it doesn't say that, then it's not a ding, and it does not go in the column.
Correct.
And you and I suspect, and I think you know, that there are several cases where the physician will not put drug overdose in as the primary cause of death.
Yes.
Either perhaps to save the feelings of the family, or because it's not a primary but a secondary cause of death.
Yeah.
Something like that.
Yeah, that can be a true representation sometimes, that it wasn't the first cause of death but may have contributed. But that ends up happening a lot. And I think that the state's primary purpose for doing that, according to some of our research and talking to the grant coordinators that we have at the state level, they're only allowed to mark one cause of death per one death certificate, just to keep numbers in line. So it doesn't look like when you're looking at all of the causes of death, if they mark down an overdose and a heart attack, for example, and they count one tick in each of those boxes for one death certificate, that looks like two deaths instead of one death. So that's the main reason why they don't do that.
Now, how did you guys come up with the numbers that you got?
We come up with these numbers because we look at the secondary and tertiary causes of death.
Who's the we?
We, the Overdose and Suicide Fatality Review Board of Jackson County.
Let's say that one more time for the viewers, because it's a mouthful.
The Overdose and Suicide Fatality Review Board, or OSFR.
Well, we'll leave the abbreviations alone for a moment. This is a board of folks. Are they mostly local folks?
Yes, all local folks.
All local folks.
Yeah.
And who would they consist of? Not necessarily the names, but the positions.
Right now, we have invites out to local law enforcement, so the sheriff and Jackson County Police, Wellston City Police, and I think even,
Kevin Aston?
Yes, the health department convened this board with sanction from the county commissioners.
So Kevin's actually the chairman.
Yes, he started it all, put it into place, thought it was a good idea that we do this review.
And the idea is to try to get accurate statistics on the drug problem that we all know and fear in Jackson County.
Yeah, so we look at unintentional causes of death, suicide, and overdoses normally. And the goal really is to bring in all of these collaborative partners and look at what interventions could we have put in place potentially to prevent this preventable death. So we have representatives from some of the treatment facilities that may know these individuals, law enforcement that may have dealt with individuals, the health department, of course, and I think the probation department is pretty involved in our overdose fatality review board, the coroner, county coroner.
So this is a broader perspective
Yes.
than the state has, and more particularized case by case.
Yes, and it's kind of local to us, so we get to really sit down and say, what could we have done? This is someone living here in Jackson County. How can we in the future change what we're doing to prevent these types of things from
I
happening?
remember that the late Judge Mark Music was extremely interested in this problem, and he was very upset that we were losing so many young people
Yep.
to this
He had a
problem.
big hand in a lot of the post-overdose response and fatality review boards.
So it's a big shout out to
Yeah,
my late friend Mark Music.
Judge Music.
Okay, our viewers might want to know what drugs are typically involved in these overdoses. Let's talk about the overdose deaths.
Most overdose deaths are linked to some kind of opioid, whether it's fentanyl, carfentanil, or a synthetic opioid, sometimes prescription opioids. And then we do see a lot of...
Can we break that down a little bit? We hear the phrase fentanyl.
Mm-hmm.
That's in the news a lot, so we know that one.
Yes.
And what about Oxycontin? That's been in the news over the past several years. Is that an opioid?
It is, yeah.
Is that still, do you still find that in Jackson County?
I don't know that they make OxyContin anymore. I think they may have stopped. They are also have stopped making like Percocet higher than 5s. You used to hear about like Perc 30s all the time. They don't make those anymore. If you hear that somebody's selling those or using those, most of the time it's pressed fentanyl.
Heroin, morphine, cocaine?
Yeah, heroin, morphine, some. A lot of times people that think they're using heroin, they're again getting fentanyl. That seems to be the cheap alternative to all of these opioids, and people are pressing it into pills that look like OxyContin or Percocet, or they're mixing it into other things and marketing it as heroin.
So it's cheaper, way cheaper.
It is cheaper
to manufacture.
Yes.
I see.
Yep. It uses very little.
And I think famously fentanyl doesn't take very much of it to kill you.
It does not.
Has there been a trend in overdose incidents and deaths over the past several years?
Yeah, over the past few years, especially since we've really started harm reduction efforts, we've seen, overdoses and overdose deaths go down pretty significantly.
What is Narcan?
Narcan's the brand name. Naloxone is the actual generic drug name.
So when our viewers see these overlays and it says
Naloxone.
Naloxone, it's really it's
Narcan, yeah.
It's the Narcan that we hear so much about.
Yes. So
what is it and what does it do and what does it not do?
Narcan or naloxone is an overdose reversal medication. So it works by blocking receptors in the brain from identifying opioids in your system. So we have these little cones of receptors, and it acts as like a little ball that sits right on top of that cone and prevents your nervous system from recognizing that there's an opioid present.
So it prevents intake of the opioid by the nervous system?
It prevents, recognition. Recognition.
Okay. And how long does it last?
About 30 to 90 minutes, usually.
That's the Narcan lasts 30 to 90 minutes.
Yes.
What happens after that?
Hopefully the person that has overdosed and received the Narcan has seen a first responder and has been transported to the hospital.
And the hospital can deal with the residual drugs that are in the system?
Yes, they can continue to administer naloxone, usually intravenously.
Okay, so somebody's at home and they've got an overdose and there's Narcan and they administer the Narcan at home and everybody thinks everything's all hunky-dory and they get back to watching TV again. Is that a dangerous thing to do?
It is, yeah. Those receptors could come open again when the naloxone wears away, and you could experience another overdose if there's still enough of that product in your system.
How do you apply the Narcan or the
Naloxone?
Naloxone?
It's nasal. Oh, I meant to bring a tester with me, but it's a nasal product. It just looks like a little
Spritzer?
It's kind of like a nasal spray that you would use. There's a little plunger on the bottom.
You've got a plunger, you operate with your thumb and you stick it up.
Yep,
up
just
your nose.
right into one nostril. There's some pretty stringent guidelines on the process that you should take with Narcan. We always say that if you're giving it, that's the best thing you can do. You should lay the person on their back, check their airway, make sure that there's no blockages there. Insert it into a single nostril, push the plunger, leave the device there for a few seconds to make sure that the medication has been expelled from the device, and then monitor that individual for about 3 minutes. If they don't wake up in those 3 minutes, then administer a second dose. During that wait, after you've administered the first dose, you should call 911 if you haven't already, or if you haven't told someone nearby to call 911. That's important because of the time.
So you can't just go back to watching TV. You got to call 911 and
Yes.
get expert help on the matter.
Yes, it is always recommended that you call 911 and get additional care.
Yeah. Our first responders would be the police and the EMTs.
Yes.
They're trained in using this material?
They are, yes.
And do they use it fairly frequently in Jackson?
I don't know that they do right now. We haven't experienced very many overdose responses.
So the problem's reducing.
Yes.
That's going to be news, I think, to our viewers.
Yeah.
Do you distribute these Narcan kits?
We distribute a lot of them. Yeah, it's we.
Have we got a statistic on that?
Yeah,
Flipping through my
I
sheets
think we
here.
do.
Is that the one?
Yes, naloxone kits distributed 2,173 in 2025.
This is your 2025 report. Over 2,000 kits.
Yeah, very proud of that. Very proud of our harm reduction coordinator. She has done an amazing job. She supplies it to a few of our vending machines here in Jackson County, to law enforcement, to EMS. Some of the treatment facilities, they'll issue it when somebody completes the program.
What is Project Dawn?
That is an acronym. DAWN stands for Deaths Avoided with Naloxone. Began in 2012 in Portsmouth, Ohio, after the death of Leslie Dawn Cooper, who was an individual that overdosed in a public area. It was witnessed by several people who had no idea how to respond to an overdose. Tragically, she died because of that. So this program was started to get naloxone into the hands of lay people, train them in a quick and efficient manner to administer this incredibly safe drug, hopefully save lives.
This was her mother who...
Yeah, it was her mother
established this?
who really started the program. You know, I think she spoke pretty publicly about naloxone being an incredibly safe drug, and why isn't it more readily available? And so the Ohio Department of Health started the program because of this story and because of the mother's response.
Mm-hmm.
And now I think I read that there's Project Dawn programs in 83 of our 88 counties and at 500 different sites.
Do they keep statistics on use of the Narcan?
Yes, we do. We complete a monthly distribution log. We keep an encounter list. Every time we distribute to a member of the public, we do like an intake form. We don't collect any information about the individual, but we do collect information on whether it was like their first naloxone kit, if they used the last one they had, things like that. So we track the number of people that we train to administer naloxone. We track the number of kits that we hand out to community and to law enforcement separately. We also recently began tracking the number of kits that we put into vending machines or nalox boxes. And then the number of overdose reversals by law enforcement and by community members that's self-reported.
So this has got nothing to do with good morality, bad morality. It's
No.
got to do with trying to save the life.
Correct. Yeah.
When you're on the spot, you've got to do something, and this is something you can do.
Yes. Yeah.
Well,
Okay.
it saves the life, but it's also good for the community in some other ways too.
Yeah. And it really gives us, naloxone is kind of a temporary crutch to this issue, right? We're trying to save people's lives so that they're still alive when they make a decision to come to us and say, I need treatment, I'm ready for it.
You can make adequate, appropriate referrals.
Right. Yeah. So sometimes it takes time for people to get to that place. So like I said, we're meeting them where they are right now, physically sometimes, and also, mentally. We don't judge. We don't care what kind of behaviors or decisions you're making. We really just want to be there to improve what you'll allow us to help you improve.
Well, while you may care, but it doesn't influence what you do.
We do, yeah.
Yeah.
We do care, but we don't judge someone
All right.
based on it.
That's a nice segue to the next question, which is, what is a sterile needle exchange?
Sterile needle exchange, or a syringe service program, SSP is what I often call it. It's a public health initiative that provides people who use drugs with access to clean and sterile needles in exchange for used ones.
How many do you exchange at a time?
So every program's different. Our program, we do a 1-for-1 exchange. So however many used needles they bring in, we give them that amount, up to 30. We don't go over 30. We'll collect more than 30. We have sometimes people will bring us 40 or 50, but we only dispense 30 clean ones.
And what do you do with the dirty needles?
They go into sharps containers that we have on site. We keep sharps at the health department and at our office at Community Action. And those are collected by Holzer and disposed of separately.
Okay, so those are needles that don't end up
On the street.
on a forest trail or on the street somewhere.
Or in the
Correct.
ditch in front of our house.
Or in the ditch in front of our house, right.
Yes.
Or in parks.
And have you noticed any benefits from the needle exchange?
Yeah, we have noticed some reduction in hepatitis rates.
What does hepatitis have to do with needles?
Hepatitis C is transmitted usually through blood. So it's a bloodborne pathogen. If you're sharing needles, you're sharing blood or bodily fluids, and you can become infected. Hepatitis B is transmitted via the fecal-oral route, but can also be transmitted through intravenous drug use if there was contact with...
So there's germs on the old needle?
There's germs, so many germs, and we do not want you to reuse needles.
So what you do is you get rid of the needles, you get rid of the germs, and
Yes.
you put clean, fresh needles out there.
Yep.
Okay.
2018, since that's where we kind of started with other numbers, we had 37 new cases of Hep B and 102 of Hep C. And
Referring to hepatitis?
yes, hepatitis. Hepatitis B, 37, hepatitis C, 102. And then in 2025, we had 6 new cases of hepatitis B and 24 new cases of hepatitis C.
One of those two is chronic and very difficult to get rid of, right?
Both of these have chronic and acute forms, and I did add both chronic and acute to these numbers, but they are new infections. So we're not like recounting chronic every year.
Yeah, I see.
And are there other illnesses that can be obtained from dirty needles?
Yeah, I think hepatitis is usually our main concern.
Okay.
And other than that, mostly just like IV injection injury is what we see a lot.
What's an IV injection injury?
If people are injecting dirty needles into their skin like repeatedly, they could form like an open wound. That wound can abscess or get a staph infection or things
Just
like that.
germs around the
Germs.
hole in the skin.
Yep.
I see. All right.
Or in this case, probably multiple
Yeah.
holes in the skin.
So we've got these folks, got the Narcan, got the dirty needles. What happens after the interaction with the public authorities? Are they just left alone? Does anybody do any follow-up? How does that work?
So we have a post-overdose response team here in Jackson County. They work pretty closely with that overdose and suicide fatality review board that we talked about.
Who's on that team?
On the post-overdose response team, we have one of our community health workers from the health department, and then we have some of the probation officers that visit with the girls, and the other 2 girls are, I think, from Hopewell Health, and they're trained to respond to behavioral health issues like mental illnesses and things like that, and then also overdose.
So when the public authorities, first responders, have an encounter with somebody with a drug situation, and that's resolved, however it's resolved, and there's a follow-up later.
Yes, we try to visit them within 24 to 72 hours of an overdose incident. So, we'll receive the report from EMS or from law enforcement, first responders. That report normally goes to the coordinator of port, and then she will contact the visitors. And they arrange with each other how to, visit this group of individuals. Recently, I've noticed the lists are a lot of responses to mental health crisis rather than overdose, which is an interesting development. It's kind of been a little bit of a change.
And so that's part of the reaction. My next question is going to be, what reaction are you getting from the first responder? The police, they have a pretty good finger on what's going on outdoors.
Yes.
Out in the community, and how are they reporting? Are you getting any informal reports from for example, the police?
The health department doesn't necessarily get reports from law enforcement on overdoses. We do provide them with naloxone, so we've got a pretty good idea when they use a kit on an overdose. And if they tell us, we used this, then we do report it for Project On metrics. But most of the reports that include that information to facilitate a visit, those go directly to the port team by law enforcement. I think they seem to have a positive response to what we're doing. I know they have their plates full with other things, and they kind of hand off the overdose visits to us, which is nice. But yeah, they're involved. They have a seat at the table every time that we're, having these meetings.
Yeah, you've presented a picture today that your harm reduction program is showing results.
Yes.
That you're having fewer overdoses and fewer overdose deaths. Is that consistent with what these first responders are telling you?
Yeah. So hopefully all of our law enforcement agencies are seeing that kind of reduction in responses to overdoses.
Do they say that it's more difficult to get these drugs in Jackson County than it used to be? I'm curious about the mental health problems going up and the drug overdoses going down, because maybe some of those people with the mental health issues were self-medicating into destructive behavior.
Yeah, that is true. I'm really not sure on that. We've got a little bit of proximity to the 23 pipeline here. Not super close, but I haven't heard how difficult or easy it is to obtain drugs in the county.
What is the Route 23 pipeline?
It is the pipeline that drug traffickers use to kind of...
It's the flow of drugs.
Yeah, it's like a tree almost, 23 goes very north to south across Ohio, at the very least, and through Kentucky a little bit.
You gave a speech at Rotary, and one of the things you said that I thought was kind of interesting was you guys have fentanyl strips.
We do.
What's a fentanyl strip, and how does it work?
All right.
Yeah, take a little water so you can...
I don't talk this much. We have fentanyl testing strips, and we also have xylazine testing strips. So both of those work. They're like little, paper thin strips that can test for the presence of these drugs. We hand them out to people who use our syringe service clinic and tell them that they can test any kind of, product that they're purchasing, that they don't think should have fentanyl or xylazine in it. You use just a small sample of the product, mix it with water, and then use that strip to test for the presence.
Yeah, part of my problem was when I heard this the first time was, we're not supposed to touch fentanyl. How can you use a fentanyl test strip if you can't touch fentanyl? And you indicated that the amounts involved are okay.
Yeah.
That go ahead and mix the material up in water and give the test.
Well, fentanyl is used in human medicine and in veterinary.
Well, sure. I was given fentanyl in my stent operation. Sure.
Yeah. There's a little bit of a misconception that people can overdose on fentanyl just by touching it, that it seeps through the skin barrier, which is a myth. There are forms of fentanyl that do absorb through the skin more easily, but those are manufactured to do that. So a lot of times people will have fentanyl patches, similar to morphine patches, that are prescribed by a doctor for some kind of condition.
Localized pain.
Yes.
Yeah, I also have on my list here, it might be useful to make condoms available for folks.
Oh yeah, we do all kinds of harm reduction. And I say this all the time, that harm reduction is not a new concept. Most of public health is harm reduction and prevention. We do things like food inspections, pool and campground inspections, tattoo shops. We run a reproductive health clinic. Most of public health is just trying to inform people and educate people to make better health decisions and reduce risk of unhealthy behaviors. We're just taking a, drug injury related stance on harm reduction. So we do provide the syringes, the naloxone, sometimes even supplies for safer use of drugs, such as like sterile waters and cottons. They're little tiny pieces of cotton that are used as filters, but there are everyday things that we hand out and do that we have all kind of taken for granted and don't realize are harm reduction. So sunscreen, hand sanitizer.
I noticed smoke detectors.
Smoke detectors, condoms and barriers. All of those things are harm reduction, limiting risk and reducing ill effects of risky behaviors.
Okay. That concludes my list of questions. And we'll just shut her down at that point. So this has been Sasha Johnson, Jackson County Health Department Harm Reduction Program.
Thank you.